Heart attack versus cardiac arrest. Know the signs. Save a life. Hello, dear friend. Let's take a few quiet moments together. Today, we're talking about the one thing that never rests. Your heart. It beats with love, with memories, with decades of laughter and loss. But sometimes it sends a signal, soft at first, then screaming for help. And knowing the difference between a heart attack and cardiac arrest might just help you save a life, maybe your own. Let's walk through this side by side. What is a heart attack? A heart attack is not sudden thunder. It's more like a slow storm brewing in the arteries, a blockage of blood, of oxygen, leaving your heart muscle gasping. It happens when blood flow to the heart gets blocked, usually by a buildup of fat or cholesterol in the arteries. Think of it like a traffic jam in your blood vessels. The heart muscle doesn't get the oxygen it needs and it starts to get damaged. Myocardial infarction, medical term, is the clinical name for a heart attack. Myo, muscle, cardial, heart, infarction, tissue death from lack of blood. So, myocardial infarction literally means heart muscle death due to loss of blood supply. And here's the thing. Heart attacks don't always come like they do in the movies. It's not always someone clutching their chest and falling over. Let's break down the most common symptoms. Watch for these quiet alarms. Chest discomfort. A pressure in your chest like someone sitting on it. Most people feel pressure, squeezing, or pain in the center of their chest. It might last more than a few minutes, or it might come and go. 2. Pain in other areas. You might feel pain or discomfort in your arms, back, neck, jaw, or even your stomach. For example, a woman might think it's heartburn or indigestion, but it's actually her heart. Shortness of breath with or without chest pain. 4. Other signs. You might break out in a cold sweat, feel nauseous, lightheaded, or suddenly very tired. But it doesn't always shout. Sometimes it whispers. Not all signs come at once, and they don't always follow the rules. Special note for women. Now ladies, I need you to listen especially closely. Your heart may speak in subtler tones. Women can have different or less obvious signs. Yes, chest pain is still the most common symptom, but some women may feel pain in the back or jaw shortness of breath, feeling unusually tired, anxiety, or even flu-like symptoms. You might chalk it up to stress or aging, but please don't ignore it, because it might be just in time to get help. What to do during a heart attack. Here's what you do if you think you or someone else is having a heart attack. Call emergency services immediately. Don't try to drive yourself. Don't wait and see. Chew an aspirin, if recommended by your doctor. It can help thin the blood. Rest while waiting for help. Don't try to tough it out. Then comes silence. Cardiac arrest. If a heart attack is a storm, cardiac arrest is the sudden power outage. The heart's rhythm is lost. No beat, no blood, no breath, just silence. It happens without warning. One moment they're standing. The next, they collapse, still, unresponsive, breathless. This is not a wait-and-see moment. This is a race against time. What exactly is cardiac arrest? Cardiac arrest is very different from a heart attack. While a heart attack is a circulation problem, cardiac arrest is an electrical problem. The heart suddenly stops beating correctly. It's like the power gets cut off, and the heart can't pump blood anymore. That means the brain and other organs don't get the oxygen they need, and it happens fast. If no one steps in, the person can die within minutes. Cardiac arrest symptoms. The person suddenly collapses. They are unresponsive. You tap them, shake them. No response. They're not breathing or only gasping. It's terrifying, I know. But knowing what to do can give someone a second chance. What to do during cardiac arrest. If someone goes into cardiac arrest, here's what to do. Call emergency services immediately. Check for breathing. Tap, shout. No response? Start CPR. Push hard and fast in the center of the chest, about 100, 120 times a minute. A good rhythm? Think of the beat of Stayin' Alive by the Bee Gees. Use an AED, automated external defibrillator, if one is nearby. Don't be scared. It will walk you through what to do. It talks. It helps. It saves lives. Keep going. Until help arrives or the person begins to move or breathe normally. You might feel scared, but even doing something is everything. The roots of risk and prevention. Let's take a deep breath now, because here comes the hopeful part. Your heart does a mighty job, but it needs care too. Here's how to lower the odds of either storm. Quit smoking, get moving. Even 20-30 minutes a day of walking helps. Eat smart, more fruits and veggies, less salt and sugar. Manage blood pressure and cholesterol. See your doctor regularly. And if you've been prescribed medication, take it as directed. Living after a heart event. If you've had a heart attack or even survived a cardiac arrest, you're not broken. You're healing, and life can still be full and meaningful. Many survivors take part in cardiac rehab, a program with exercise, support, and education to get you back on track. Some may get a small device called an ICD. It monitors your heart and can deliver a small shock to restore rhythm if needed. It's normal to feel scared or anxious afterward. Talk to your doctor, join a support group, lean on friends and family, know the warning signs. Let's do a quick recap together. Heart attack. Warning signs: chest pressure or pain in arms, neck, jaw, or stomach. Shortness of breath, cold sweat, nausea, lightheadedness, fatigue. Cardiac arrest. Warning signs: sudden collapse, no response, no normal breathing. Don't second guess. Trust your gut. Better safe than silent. Key takeaways. Your heart has carried you through years, through laughter, love, loss, and life. So when it whispers or when it cries, listen. Don't ignore warning signs, call for help, and get help fast. When something's not right, know your body. Take care of yourself and take care of your heart, like the precious thing it is, and never be afraid to speak up, step in, or save a life. Whether you're caring for yourself or someone you love, you have the power to make a difference. Thanks for spending time with me. Stay safe, stay informed, and keep your heart beating bravely.